So this is our presentation on the auricular hematoma, and this is going to be presented by Brian, Maggie, and Buck. So this is just a little outline of our presentation here. These are some of the things that we're going to talk about. So we have the definition, the pathophysiology, what is an auricular hematoma, the complications that can arise with it, the treatments and options and goals, the preventions of reaccumulation, and the prevention of cauliflower ear. So just to start off here, so we understand what it is, the definition is auricular hematoma is a blood collection under the perichondrium of the ear that can be caused by trauma. It can lead to a condition known as cauliflower ear, which is characterized by inadequately treated auricular hematoma. The pathophysiology. So this is just a little bit about where it occurs and what happens. So it's located between the perichondrium and the cartilage. The cartilage of the ear is composed of various parts such as the helix, the tragus, the triangular fossa, and the concha cavum. The blood vessels that supply the ear are composed of a pair of superficial auricular arteries and a posterior auricular artery. When the ear is traumatized, the vasculature and perichondrium are damaged, which can lead to separation of the cartilage from the underlying structures. So auricular hematoma occurs from tangent or shearing forces, most commonly seen in sports such as like wrestling, UFC, boxing, rugby, usually from a takedown or a tackle. When headgear is not present or improperly fitted is when these can occur.
Some complications are pericarditis, chondritis, erythema, tenderness, and recurrent swelling. Cartilage necrosis or death of the cartilage, contracture and or neocartilage. Hearing loss may occur, difficult wearing earphones and other headgear. Wax transport from the ear canal can be reduced or impinged. So that's just your ability for the earwax to fall out naturally, and increased risk of osteoexterna. Some treatment options are removal of the hematoma with either needle aspirations or incision and drainage. The treatment goals are adequate removal of the hematoma, maintaining pressure to prevent reoccurrence, minimal impact on patient activity, and appropriate follow-up and documentation. Prevention of reaccumulation can either be invasive or non-invasive. Some prevention techniques of invasive and non-invasive. For non-invasive, you have plaster mold application, silicone splints, swimmer's nose clip, and cotton filled with collodone. Invasive techniques are bolsters, thermoblast splints, buttons with cotton, suturing, dressing, placement of drains, either passive or suction, and antibiotic prophylactics.
So here are some of the examples that Brian was mentioning earlier for a non-invasive treatment. There's these silicone ear splints. There's the black and white pictures, what's in our textbook. And there's this company made out of California called Ear Splints, where they create their own silicone ear splints for children and adults. And this is the basic starter packet. Then if we're moving to the invasive type of ways for prevention of reaccumulation of the auricular hematoma. After aspirating the ear, there's a simple gauze packing where they're compressing the ear itself with these techniques shown below. Another non-invasive or another invasive way of aspirating the ear is the cotton bolster dressing, which this doodle right here shows the actual steps formed when aspirating the ear, how the incisions work, and this is the compression of using cotton in the anterior and posterior surfaces of the ear, and then using sutures to compress the area. There's also the technique that's invasive called buttons and drains. It's not very common with humans. Looking online, there was a lot more pictures of dogs. And so it's similar to the cotton bolstering technique where you're compressing the area once it is drained, and then after using sutures and buttons, and then after a long duration, they take them out to help with decreased swelling.
Prevention of the cauliflower ear begins with proper management and treatment of the auricular hematoma itself, and then headgear. And in the NCAA, headgear became mandatory in the 1960s in wrestling and mandatory for practice in 2004, although that's not always the case with coaches not enforcing that. And also the mandate is not international.
So our thoughts after researching auricular hematoma is making sure when you have a patient or athlete that has one of these to get treatment as soon as possible to help with aspirating the ear. Determine based on the state that you need to make sure you're looking at the state practice acts to see if an athletic trainer can actually aspirate the ear themselves or they'll need the team physician. And thank you so much for coming to our research project.
Thing.
Yeah, that's all, folks.
Bye.
Deuces.